I am Dr. Shrikant Dalwaldi. I am one of the surgeons in the team of I&U, and I am a cataract, glaucoma, and LASIK surgeon. You are watching Tililindo program on CAST TV.
Welcome to Tililindo, your trusted health program. Today we are focusing on eye health with a special guest, Dr. Shrikant Dalwaldi, an experienced ophthalmologist at I&U Hospital. He will be shedding light on common eye conditions, treatment options, and the latest advancements in eye care. To begin, let's talk about one of the most common causes of vision impairment, cataracts. Dr. Dalwaldi explains what cataracts are and the treatment options that are available in the country.
The I&U is a super specialty eye hospital. It was created with an intention to provide super specialty treatment to the people of Kenya. We basically are a team of four surgeons from India uh, who performs surgeries over here. We treat all kind of uh, possible problems in the eye, right from cataract to retinal detachment. Cataract is a person when ages, the lens, which is a natural lens in the eye, it gets opacity, which reduces the entry of light in the eye and ultimately reducing the vision. Uh, when a person gets a cataract, it is to be operated. That's what I do. The cataract surgery normally is operated with help of a phacoemulsification machine. The technique is known as phacoemulsification, whereby the entire cataract is removed from a 2.2 millimeter opening. A small incision is made along the corneal junction of the eye, and the cataract is removed from there, and a lens is implanted, uh, uh, thereby restoring the vision. uh, the lens implanted can be monofocal, multifocal, trifocal, and desired vision. If the patient wants that he does not want to wear any glasses after the surgery, we can implant the lens accordingly. We do this surgery mostly giving no injection, so it is painless. The patient immediately after the surgery walks out wearing the glasses without any patch on the eye, no stitches, no red eye. Cosmetically, it's very uh, appealing in the sense that if someone sees the patient right after the surgery, he cannot make out that the patient has been operated. Morbidity is less, no red eyes, no tearing, uh, no pain, no complications related to injection, which can be anything like hemorrhage besides the eye. It can the needle can perforate the eye, can lead to vitreous hemorrhage, means hemorrhage in the cavity of the eye, retinal detachment. There are so many complications related to the injections, which that stuff we have omitted already. And this surgery, this particular type of surgery, we are doing like the time we started, 2014. So most of the patient, like we can say 90, more than 98% of patient at our institute do not take injections to undergo the cataract surgery. So it's a very friendly procedure, and patients, most of the patients are very happy after the surgery. Visual recovery is almost immediate, and recovery time is very less.
Another silent but serious eye condition is glaucoma. Many people don't realize they have it until significant vision loss has already occurred. So, what exactly is glaucoma and how can it be managed? Let's hear from our expert.
Regarding glaucoma, it's one of my specialty. Glaucoma is the changes in the optic nerve. Optic nerve is a nerve which carries the visual signal. The light enters the eye, it strikes on the retina, and the impulse, the visual impulses, the light impulses are carried to the brain for processing via optic nerve. Now, this optic nerve is a structure which is affected in glaucoma. Most of the times, glaucoma is due to the high pressure in the eye, like blood pressure in the body. eye also has a pressure. If the pressure is high, then the optic nerve is the most vulnerable structure, and the high pressure leads to damage to the optical fibers, the retinal fibers. The optic nerve is basically bundle of the fibers of the retina, and these fibers gets damaged and ultimately leading to the loss of vision. The most threatening part of glaucoma is that the visual loss occurring because of glaucoma is not recoverable. Once it is lost, it is lost. So most of the times, when we see glaucoma patients in an advanced stage, the only effort we can make is to stop the damage progressing further and to preserve whatever the vision is left. Our efforts are mostly directed to preserve the vision, whatever vision is remaining, we try to protect that with help of medicines, with help of surgeries, and with help of other laser procedures. Uh, the glaucoma patients, uh, normally glaucoma patients are found as an accidental finding. The patient does Most of the patients do not come with a complaint of glaucoma. It's like in our routine examination, we find the pressure is high, or maybe we dilate the patient, we see the retina, and we find the optic nerve is damaged. Then that's the time when the patient comes to know that he or she has a glaucoma. So, our advice to all of the patients who are like above 40 years of age, all people, not patients, all people who are above 40 years of age should undergo a routine dilated evaluation, a complete evaluation of the eye. So, the things like glaucoma can be detected. If they are detected early, we can definitely prevent the visual loss. It is a thief of sight because, as I said, most of the patients are not here with the complaint of glaucoma. They just come for their evaluation. Maybe they come with a complaint of headache, maybe visual loss, or maybe something, or a routine examination. We just happen to find them and diagnose glaucoma. So it's a thief of the sight. If the patient had not come here, then he would not have been diagnosed as having glaucoma, and the treatment would not have been initiated, eventually leading to complete blindness. So it is essential to be proactive. Go to the doctor without any complaint, waiting for any complaint to happen, and maybe in a routine examination, we can find that you have a glaucoma and we can guide you accordingly. See, most of the problems in the eye are not associated with pain, so people tend to overlook them. Okay, we normally give more attention when the situations where the bodily conditions are painful. Suppose your tooth is aching, then you will immediately rush to a dentist. But a cataract, a glaucoma, or any other thing are basically, they don't cause pain unless they are in a very advanced stage. There is a condition of glaucoma where the eye pressure goes very high. It's an extremely painful condition, and in that condition the patient will rush for the treatment. In a way, it is good. The patient will rush for the treatment, he will be diagnosed as having glaucoma, and he will be treated and he will get relief from that. But what I am concerned about is the glaucoma with low pressure. There are conditions where the pressure are not high, and the patient is having glaucoma, so the patient will not have any complaint. So unless the patient goes for a screening, some condition like, even in diabetic retinopathy, we can say diabetic patients, they have some condition in the eye which is known as normally diabetes leads to some changes in the blood vessels in the eye, which leads to leakage of the blood serum, which leads to swelling of the retina, which leads to blood clots, which leads to so many other problems which can eventually affect the vision. But these changes, if not checked on an earlier stage, uh, where it is manageable to prevent the losses, then the patient can turn up at a very late stage when the things have gone out of the hand, and we have to do some major procedures to just restore their vision, and we may not be successful even at that time. Normally, here in this part of the world, in Africa, uh, people are like, we normally, out of every 10 patients, there is one patient who is having glaucoma. So prevalence of glaucoma is more in Kenya as per our observation. We practice in India and Kenya, so we have ready comparison. So we do not see these many patients in India, but here every 1 out of 10 patient is having glaucoma, mostly open angle glaucoma, which is with low pressure, and mostly patients we see are diagnosed late. We have seen patients as young as 25 years having glaucoma. So I think my advice will be, don't overlook any issues with the eye. If you have a little bit of a visual complaint, or maybe redness, or maybe pain, or maybe some family history of glaucoma, if you have your parents having glaucoma, some siblings having glaucoma, then there are many chances that you also have may have glaucoma. So in these conditions, it is essential to get your eyes evaluated, even if you don't have any complaint. If they are screened, if it is established that they don't have glaucoma, then an annual checkup will be sufficient for them. But if they have glaucoma, then definitely they have to go for some treatments, like maybe medicines in form of drops, which controls the eye pressure, and there are few tests which are done for the glaucoma patients. Uh, Normally, let me explain you how glaucoma affects your vision. The vision, or the visual component we have, like I'm seeing you, at the same time I'm seeing something in the periphery. The peripheral vision is affected in the glaucoma. So even the patient with the end stage glaucoma, the very advanced stage of glaucoma, will able to see whatever is in the line of their vision, the straight things, but the side vision will be affected. So we have a test to check the peripheral vision, which is known as perimetry or visual field analysis. We normally perform that on our patients who are diagnosed with glaucoma, and we repeat this test on like 6 months or a yearly basis, just to check that how the treatment, if at all initiated, how it is effective. If there are changes found at the end of a year which are more than what we have initial results, then we happen to change the medicines, or maybe we advise some surgery. There is another test which we do for glaucoma patients, which is known as OCT. It is scan of the eye. So we measure the first test, visual field analysis, was the physiological test. It is functioning of the eye. The OCT is anatomy. We actually measure the structure of the eye, how the eye looks, the cupping and everything, the technical details. But we just have that as an initial measure to check the progress of the disease over a period of time. So at INDU, we do it very scientifically. We try to keep the track of the patients. We even remind them for the follow-ups, and we see how the treatment is effective over a period of time, and we make sure that the patient do not lose vision just because of just they feel that it's everything okay after putting the drops. We make sure they come here, they get their eye evaluated for the perimetry and OCT on a yearly basis, or a 6 monthly basis, and we titrate the treatment accordingly. In the advanced stage, we perform surgeries to make sure the patient remains with the vision. Glaucoma, if diagnosed early, we can start the treatment. We can make sure that the changes does not progress further, and we can try to preserve the vision. When the patient comes late, it is already he may have lost, she may have lost like 80 to 90% of the vision. That's the late stage glaucoma. So here it's matter of survival. So we have to treat very aggressively. We may suggest some surgery even in these patients, but the chances of progression in a late stage are more, or rather failure to control the progression is more in the late stage glaucoma than the early stage glaucoma.
Beyond cataracts and glaucoma, there are other conditions that affect the cornea, such as keratoconus. But what is it and how does it impact vision? Here is what you need to know.
Keratoconus is something which is more prevalent over here. Keratoconus is the the black part of the eye is known as cornea. Okay, it's a clear lens which allows the light to enter the eye, and it focuses in a very regular fashion. In keratoconus, the curvature of the cornea, the black part of the eye, it becomes conical, it becomes irregular, and it happens. If the patients are more in Kenya, it's more related to allergy. Most of the patients are having allergy over here. And the keratoconus, if detected early, we can treat these patients with a procedure which is known as corneal cross-linking, which increases the tissue bonding. It does not allow to lose the shape of the cornea any further. In advanced stage keratoconus, the cornea is distorted. It has some scarring, some opacities, which does not allow the light to enter. In these kind of patients, we do corneal transplant surgeries, and corneal transplant surgeries we do a lamellar we do a lamellar corneal transplant surgeries over here. So we just change a layer of the cornea, the black part of the eye. It has 5 layers. So normally surgery is done, we the whole button is removed and a new button is sutured over there, the corneal button. But what we do here, we just remove a lamellae, a layer of the cornea, which is not okay, and replace just the layer. The chances of success of these surgeries are more than the full graft surgery. This is something advanced that technique that we perform at INDU. In diabetes, normally what happens? The viscosity of blood, viscosity is thickness of the blood, it increases. So the blood becomes more thick and it does not flow in the micro vessels. We because we have bigger vessels in the body, which in turn they are bifurcated into smaller vessels and they supply blood all over the body. So the smallest of the vessels, which are known as capillaries, they are the one which are impacted the most. Now the blood flow there is stagnated, it does not flow. So the nature has its own system to deal with this. So it comes with some newer blood vessels. It produces some newer blood vessels to give blood supply to these areas where there is no enough blood supply. These newer vessels they are thin, they are not strong. So these thin blood vessels, they happen to leak the blood and the serum, and then they can lead to this corneal. It can change the structure of the retina. The blood deposits, the serum deposited in the blood, in the layer of the retina, it affects the functioning of the retina. If not taken care of at an early stage, these blood vessels can grow into the eye, they can bleed in the eye, it can cause some fibrosis, it can eventually detach the retina and can lead to a vision loss which is not recoverable. So all the diabetic patients, any diabetic patient has to have their eye examined on an annual basis without waiting for any complaints, because some of the early changes, if detected, they can be treated and can be the progress can be arrested with help of lasers, injections. There are so many modalities of treatment in the early stage of diabetes, and the vision can be preserved for life.
These days, it seems like most children are wearing glasses than ever before. Could it be due to screen time or other factors? And at what age should we start prioritizing eye checkups? Our expert explains.
I think people are more aware nowadays. So there is a lot of parents are aware. They take their kids for eye evaluation. Even the school screening programs are there. So it's because of these things that we are able to have more people wearing glasses. Uh, this is nothing otherwise. People use their eye more. There are a lot of gadgets and there are a lot of work which are done. Eye has become very important because you are doing so many things with them. I mean, gadgets, the screens, the computers, and all sort of things. So I probably these are the reasons we are getting more people, more kids having glasses. It's more of a awareness sort of, I think, because people, there is nothing special about it that all of a sudden the numbers have increased. It's just the awareness. There are a few tips that I like to give. If the kid is seeing the things from very near distance at the early age, like before he understands alphabet or starts reading, if he's looking the things from very near distance, or maybe he's seeing the television screen from a very near distance, you have to doubt that he has some issue with the eye. You immediately take the child to an ophthalmologist for screening. Otherwise, whenever the child starts reading, he can be taken to the ophthalmologist for evaluation. I think that's the right age. Opticians are the people who are qualified to check the eyesight, the numbers, and dispense the glasses. We as an ophthalmologist, we do much more specialized work than the opticians. Okay, uh, we evaluate the eye, we check the retina, we check the other parts of the eye, we check the eye pressure. We are subject experts. We are experts with the eye. So for the primary things, you can always get your eyes evaluated with an optician for the numbers. But if there is something which is not okay, or maybe there is some other problem, I think opticians are not sufficient to deal with those things. Till the power of the eye, the numbers of the eye, the spectacle checkup, it's okay. But if there is something else related, more than that, then you have to definitely visit an ophthalmologist. After 40 years of age, I think every year eye checkup should be done, because these are the times when the things are like, uh, we are aging. No? After 40 years, the aging starts. So there are many changes that happens with the aging. So every yearly checkup after 40 years of age is okay. As I said, in case of child, if the child is reading, that looking at things from very near, then at the whatever earlier stage you can, if you come to see a problem, you should go to an ophthalmologist. After 3 years of age, when the child starts reading, eye evaluation should be done. Any younger age, if you have some problem, then anytime, for the younger people having myopia minus numbers or some eye issues, uh, they have to visit the ophthalmologist every year. For the keratoconus patients, they have to visit as early as possible. For all the high myopia patients, they should visit the ophthalmologist to get their retina evaluated, because in high myopia there are some issues related to retina. Even in younger age, there are weak retinal areas in the periphery that they can be treated, and we can avert some major problems in the eye. And for the patients having myopia, again with astigmatism especially, they should get their eye screened for keratoconus.
There is a lot of valuable information so far, but we are not done yet. When we come back after the break, we will be busting some common eye health myths. Stay with us.